If you can get rid of 90% of pain in your body without manual therapy or medication, would you do it? Well, stick around because I'm gonna share with you exactly how to use this foam roll or this massage wheel to address many different parts of your body. So I'm Dr. Jason Won. I'm an orthopedic doctor of physical therapy, and I'm gonna share a few exercises that will help you to address many different chronic painful areas as well as stiff areas in the body using just a foam roll. So make sure to stick around and also to subscribe, click that bell notification so you don't miss out on any great content like this. We host weekly videos Mondays at 5 p.m. So this is gonna be a very detailed breakdown addressing many areas that a lot of desk professionals and parents actually have in their bodies. Namely, we're gonna start off with the neck and upper back first, a common area that people have pain in, especially when they're sitting at a desk with sometimes poor posture. Then we're also gonna address tight shoulders. So a lot of times we're kind of forward bent and we're also very internally rotated. So I'm gonna show you how to free up your shoulder mobility. Then we're gonna address the low back as well as the hips, a common painful area because we do sit a lot for work. And then we're gonna address as well as the knees, as well as the ankles, as well as the calves. All right, so let's get into it now. So this massage wheel here is one of the best tools that you can have. This is a very common tool that I have in multiple rooms in the house. And so I'm going to share with you, it's a 6-inch wheel here. I'm gonna first address the neck and upper back. So what you do is you simply just lie on the floor, and where you always start off the foam roll is about your mid back right here. So the mid back, we're going to put our hands behind our heads and interlace your fingers. Make sure you're not contracting your neck, and make sure you keep your neck completely relaxed into your hands. So now I'm kind of relaxed here. What I'm gonna do is lift up my butt just about 1 millimeter off the floor. I'm going to roll back and forth. And I'm initiating that movement not by kind of army crawling. I'm actually just lifting up my butt and then using my knees and bending and straightening. So I keep my body relatively straight and parallel with the floor. And even this in itself can address a lot of pain in the neck and upper back, just rolling back and forth. But in just a little bit, I'm gonna share with you some specific techniques. So what you're gonna drop down is you're gonna drop down into an area that feels particularly tight. From here, you're gonna learn how to take out slack. Now, this is something that a lot of physical therapists actually don't teach very well, is taking out slack. So the muscles that actually attach into our neck and upper back also attach directly into our pelvis. So I'm gonna take out slack from the bottom first by posterior pelvic tilting. So when you do even that motion, by kind of drawing your navel, kind of bringing it up towards the ceiling, is you're going to feel a lot of that slack being taken up, and you'll feel a bigger stretch where the foam roll is. Now we're going to take up the slack from the top of the foam roll by chin tucking and also elbows forward in front of our nose. From here, now we can actually go into thoracic flexion, and what that means is bending forward. So take out slack, elbows in front of your nose, chin tuck, and we're going to straighten our knees and roll. And so if you have any pain with looking down either at your phone or looking down at the computer, this would give you a great way in order to improve flexion of your spine, is by actually pulling up a little bit on your head, taking out slack, and then rounding. So we call that thoracic flexion. Now, we also want to improve our posture and straighten up our body. And when we improve what we call thoracic extension, that not just improves our mid back and our neck pain, that also can improve overhead shoulder mobility, which we'll go through a couple shoulder exercises in just a bit. So now I'm going to find a spot that feels particularly tight, let's say around the middle thoracic spine. Now I'm going to do the same thing. So tuck my pelvis under, again, taking out slack from the bottom, chin tuck, elbows in front of our nose. And now we're going to exhale and now bend backwards instead of forward. And usually we give a nice little exhale. That way we can kind of envelope our body over the roll. If you do hold your breath or you do inhale, you're not gonna get as far. So you wanna exhale and kind of relax over the roll. And then once you address that spot a few times, then you can address areas closer to the neck or even down here, which we call the lower thoracic spine. Again, exhale. And usually you can do this for about 5 to 10 reps in each area. Okay, so that's kind of the series for our neck and upper back. Next, we're gonna get into people with tight shoulders. So with tight shoulders, what we wanna think about here is addressing the lats. The lats is a common area that does get tight. Now, whether you're somebody that actually does a lot of pull-ups or you're somebody that simply just sits at a desk or does a lot of chores, we oftentimes will start to get tightness in our shoulder blades as well as our lats. And our lats can restrict certain motions like reaching for a seatbelt or sometimes reaching overhead. So if that's you, make sure to stick around and follow this exact tutorial. So I'm going to address the lats here, and I'm gonna place the roll directly right in my axilla or right at the armpit. So even just rolling here, you actually don't even have to roll. Just that pressure alone, it's gonna allow that muscle to kind of relax. So if you have any tension here, just simply stop here and just start breathing. And exhale. And what you'll notice is that the painful areas that previously were tight, over time, even just 30 seconds to a minute, you'll notice that your body kind of relaxes into the roll and that muscle pain starts to dissipate. So we're just gonna simply breathe here and exhale. And lastly, we'll do it again. Okay, now we can actually start to roll back and forth. So I'm actually lifting up my hip a bit, just kind of rolling side to side. And then the other thing that you can do here is you can actually address certain motions with your shoulder. So I call this, for a lot of my clients, mobilizations with movement, where when I pin a certain tissue that is very tight or restricted, I'm also incorporate a little bit of circular motions here, like so, maybe 8 to 10 reps. I also incorporate a little bit of what we call internal rotation and external rotation, especially if you have any restrictions with more rotary movements of your shoulder. And I can also address this. This is one of my favorite things to do, which is called the figure 8. And the reason why I would do this is for anybody that has pain in their elbows, their wrist, or has any numbness that's going into their hands. I guess what we call like kind of neuropathy. We wouldn't consider this carpal tunnel-like syndrome, but if you have any numbness in your hands or numbness in your forearms, especially typing for a long period of time, this can be a great way to address all the little nerve bundles that go from our neck all the way down through our lat and through our axilla, down into our hand. Okay? Now, after we get some of that, you can also roll directly onto your shoulder blade. A lot of times what I'll do is I'll get onto my shoulder blades like so. Again, you might find a tight area, and any painful area, you don't have to roll yet. You can simply just sit in that one spot and relax. And that's the beauty of foam rolling, is you don't really have to roll. You can simply just rest into it. But once I kind of get situated in this area, then I'm going to kind of roll out those tissues too, okay? I'm usually kind of like just cupping my arm and rolling. And again, it's a great way to address a lot of different chronic painful areas like the shoulder, the mid-back, as well as the neck, okay? So the next area I'm gonna address now is the lower back. Now, the lower back, you have to be somewhat friendly and do this properly, because what I don't like for a lot of my clients to do is just get the roll into the lower back and then just bend backwards. A lot of times, if you're too aggressive with it, you may actually end up with more low back pain. So what I tend to do is I like to support myself either with my hands. I like to keep my abs engaged so I'm not overextending. And what I can do here is now I can either I can just go and cross my legs, and I can actually kind of stretch out the lower back. So when I cross this leg, it actually pulls up some of the slack out of the lower back. The other thing I can do is I can also just kind of do some posterior pelvic tilts like so. Okay, and you can support yourself like so, okay? But what I usually like to do is, even if you had low back pain, as long as you're addressing the middle back pain, so from your rib cage up to the base of the neck, a lot of times that can help the low back to get more mobile as well, just considering that the spine is one unit, okay? I'm going to address now the hips. So if you have anything like piriformis syndrome or sciatica, or even if you just have generally some tight hips, this can be a great way to loosen it up. So usually I'll situate the roll like this. And even just here, again, you can just stop into this one area. But if you want to enhance the stretch, what I'm going to do is I'm going to put this tissue that is pinned by the roll, I'm going to put it under stretch. And so I'm going to externally rotate my hips into this figure 4 position. And I can actually just go into more of a mobilization with movement for my hips, addressing internal rotation as well as external rotation. And then the other thing I can do is I can just drop it down, okay? And I can just kind of sit onto my, what we call our greater trochanter. And because there's so many tissues that attach directly into the greater trochanter, it can allow a lot of the muscles in your hips to relax, okay? So last areas I'm going to address are the knees. So if you have any knee discomfort, and then we're going to go into the calves as well. So with oftentimes anterior knee pain, if you have any pain that's in the front of the knees, then what you're going to want to address is not having the roll contact the actual patella. So we don't want to usually have the roll contact bony prominences like your kneecap, but we want to address the tissues above it, namely the quad. Okay, people oftentimes are very quad dominant athletes. So what we're going to do is, if it's my left quad, I'm going to start it right above my patella, and I'm going to get into this army crawl position. And again, what you can do here is, what I like to start off with is just either getting into that painful spot, again, doing that same breathing technique that I showed you, but I can also now start rolling it out. You want to do your best to try to relax, because these areas can feel very tight. And oftentimes if you feel too tight or if it feels too painful, you can tense up. So do your best to kind of just exhale and relax into those areas. And then once you sometimes find a tight area, let's say the middle of my quad feels tight, what I can also do is another mobilization with movement, and I can pin that tissue down and then bend my knee. So basically you're doing a hamstring curl against gravity. And what we're doing is now kind of actively stretching that quad too. Okay, and you can also address this. I'm going to show you on my right side, but you can also address the lateral tissues of your leg. This would be like a mixture of your lateral quad as well as your IT band. I'm not a big fan of just rolling out the IT band. A lot of times you can just roll at the hip, and then that can start to help the knee. But I like to kind of pin my knee onto specific areas that feel tight. So if that area feels tight, I can also, again, incorporate a little bit of a knee bend and kind of floss that quad or floss that IT band while I'm getting a little bit of movement, okay? So you can also address the other side. So if you have any hamstring tightness, or maybe a lot of times you have more like sciatic-like symptoms, you can just bend this leg to give yourself a little bit of a support, and then just roll back and forth like so, okay? These areas usually aren't as necessary. I find that some people do like to address the hamstrings, but namely if you have more knee pain, I would address more so the front of the knee, like the quads, as well as the lateral aspect of the knee. But for the hamstrings, I usually like to incorporate some strength training and some dynamic movements to address any hamstring mobility deficits, okay? But the calf is a very common area, especially if you have, let's say you have tight calves. It's a mixture of if you sit for a long period of time, or if you do a lot of hiking. So if you do a lot of hiking up hills, your calves can get tight, especially in the San Francisco area. There's a lot of hills here, so these areas can get tight. So I'm just gonna simply pin that calf down. Again, give myself a little support from the other leg. You need a little bit of upper body support, so I'm going to straighten out my elbows and just roll back and forth. Now just rolling, what I can do here is I can have my foot go inside. That's addressing more of the inside calf, or what we call the medial gastroc. And then I can also address the lateral side and point my toe out and address any tissues that feel tight on the lateral aspect of my calf as well, okay? And then what you could do is, again, the similar mobilization with movements. So if you feel any area that feels particularly tight, like let's say it's the lower part of my calf, then I can also just stop in that one area and then also address dorsiflexion and plantar flexion, okay? So to kind of just summarize everything is that with one foam roll, you can address many tight areas of your body, and you can either just stop in that one spot that feels tight and you can breathe in order to relax the tissues. You can also just simply roll back and forth dynamically. And I would use that more so for when you're kind of warming up, like before sports, or let's say after a long day of work, you need to address certain areas. And again, you can also address specific areas, more trigger point like, by doing some mobilization with movements. Okay, so if you did have any questions, if you found this helpful, also comment below. So any questions that you have, feel free to let me know. But also if you found this helpful, feel free to subscribe, click that bell notification, and we'll see you on the next one.